Hello, and welcome to the new provider orientation. My name is Anna, and I'm a Behavioral Provider Relations Representative here at Evernorth. This orientation is geared towards hospitals and facility-based programs. During the next 30 minutes, you'll learn key points for working with us and administering benefits for patients with Evernorth coverage. Please note that you do not have to write down all the contact information I present today. The Welcome to the Network email that you recently received includes all of the highlights we'll be covering, including key phone numbers, email addresses, and websites. Evernorth's mission is to improve the health, well-being, and sense of security of the people we serve. Because you play such a vital role in the health and well-being of our customers, it is a priority for us to develop long-lasting and productive relationships with healthcare providers. My goal in this orientation is to give you the tools you'll need to start working with Evernorth. Our provider services team is available at 1-800-926-2273. The provider services team is designed to be a one-stop shop in addressing your questions and concerns. Our advocates can assist with eligibility and benefit quotes, status inquiries, claim status checks, and problem resolution. They can provide basic information on initiatives that may be of interest to you, information about joining the network, and will triage your calls to the appropriate teams. They serve as your initial point of contact. The provider relations team is dedicated to improving your experience working with Evernorth. We're working with you as well as behind the scenes to make working with us easier. Please contact your PR rep if you have questions about your contract or rates, or if there's any questions that an advocate can't resolve, but always feel free to ask for your PR rep. To find a PR rep covering your state, please see the Evernorth Behavioral Health Key Contacts flyer in the Welcome to the Network email that you recently received. Our after-hours team is available for after-hours crisis situations only by calling the provider services number. This team is not available for administrative questions. It includes advocates, care coordinators, and clinical care managers. Credentialing can take up to 60 days to complete. Once you're contracted, you'll be notified that the contract has been signed and executed. Re-credentialing takes place once every 2 to 3 years. During re-credentialing, you must provide your National Provider Identifier, or NPI, in addition to copies of your state license, your national accreditation if applicable, or your state license survey results. Also, your contract with the Federal Patient Safety Organization or Hospital Engagement Network or Quality Improvement Organization if applicable. Your certificate of insurance, both professional and general liability, and your Medicare certification if you're Medicare certified. Contact your Evernorth contractor for contract maintenance matters, including rate review requests, to add or remove services, to add or change service location information, or to request change to your contract language. Refer to the key contacts flyer in your Welcome to the Network email to locate your contractor. Please note that if you would like to update demographic information other than service location, such as email addresses or telephone number, so please contact your Evernorth Provider Relations Representative or Provider Services. Evernorth has a number of product offerings, including HMO, PPO, or Open Access Plus, as well as standalone employer products. It's important to contact Evernorth when you receive a new patient to verify their benefits. Benefits will vary based on the product type, amongst other factors. Our provider advocate team can confirm the correct claims payer for each new Evernorth behavioral patient. Evernorth also maintains alliance networks with other health companies that access our network. Claims for alliance customers are paid by the health company that manages the benefits. For more information about our alliances, please refer to our Behavioral Administrative Guide at the Evernorth website, provider.evernorth.com. You'll go to Resources, Behavioral Resources, Doing Business with Evernorth, Third-Party Administrators flyer. 3rd-Party 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 The last product offering I want to mention is our Medicare Advantage product. Medicare Advantage HMO and PPO markets are not available nationwide. Please refer to the Behavioral Administrative Guide to see if Medicare Advantage is offered in your state. You can tell if you are in network for Medicare Advantage by referring to your participating provider agreement. You can outreach our Medicare Advantage service team at 800-230-6138. They can help with claims and claim resolution, eligibility and status checks, billing inquiries, and provide basic information on initiatives that may be of interest to you, as well as serving as your initial point of contact regarding Medicare Advantage. I want to touch base on the Behavioral Administrative Guide, which may also be referred to as your Medical Management Program, or MMP. Please note that the Evernorth Behavioral Administrative Guide is an extension of your contract. For reference, all of the information we're covering today in this presentation is included in the guide. You can access the Behavioral Administrative Guide by going to provider.evernorth.com, Resources, Behavioral Administrative Guide. Moving on to our care advocacy process. Prior authorization is required for all facility-based services with the following exceptions. Depending on your patient's coverage, prior authorization may not be required for partial hospitalization or intensive outpatient programs. Before rendering services, always verify your patient's eligibility and benefits by logging onto Evernorth provider's website, provider.evernorth.com, or by calling the number on the back of your patient's Evernorth ID card. When calling in for authorization, you may be asked to provide the following information: the patient or policyholder's ID number, patient first and last name, patient date of birth, patient or policyholder's address, and patient or policyholder telephone number. Upon contacting Evernorth for authorization, you may be asked up to 4 to 5 questions about your patient's current status. Depending on your response, services may be authorized by way of a fast cert or pre-certification. Fast cert is if the clinical information you provide meets all applicable guidelines and you'd be given authorization immediately. For pre-certification, if the authorization cannot be given by way of fast cert, a care manager will call your facility to perform an initial review. If the clinical information meets all applicable guidelines, the care manager will authorize a pre-certification, and the case will continue through the concurrent review process. If the clinical information does not appear to meet all applicable guidelines and your facility does not accept an alternative level of care, the case will be submitted for peer review with an Evernorth medical director. If additional days of care are requested, the care manager will determine if the clinical information meets all applicable guidelines. If the clinical information does meet guidelines, the care manager will authorize additional days. If it does not appear to meet guidelines or your facility does not accept an alternative level of care, the case will be submitted for peer review with a Cigna medical director. Services that require prior authorization include detoxification inpatient, dual diagnosis inpatient, dual diagnosis residential, eating disorder inpatient, eating disorder residential, ECT inpatient, mental health inpatient, mental health residential, substance use inpatient or rehab, and substance use residential. You are all in network for routine services, but let's take a moment to discuss Evernorth's other access levels. Intermediate care is when you have availability for an appointment within 48 hours of a request. Crisis stabilization is when you have availability for an appointment within 6 hours of a request. This includes both 24/7 and non-24/7 options. Once you are fully contracted, we encourage you to register for our provider website. To verify your contract status, feel free to call Provider Services at 800-926-2273. Once you're registered, you can log on to provider.evernorth.com to verify patient benefits for HMO and PPO plans, check claim status, update your information, and much more. I want to take a few minutes to review some basics about claim submission. There is a detailed section in the Behavioral Administrative Guide devoted to claims payment, in addition to an appendix with helpful claims documents. One important note about claims before we move on is the coordination of benefits. A coordination of benefits reform will be requested at the first claim of the year for all Evernorth customers. While the customer is responsible for advising of secondary coverage, it may slow down your claim payment if they are unresponsive. You may ask your patients to fill out a coordination of benefits form. If you have the signed form, you can submit it to Evernorth to ensure your payments are not delayed due to lack of response. You can find the form in our administrative guide. Please be aware of timely filing, which may vary from state to state. We also have for you a self-pay agreement. You can use this for such things as a missed appointment. For more information about billing code guidance and prior authorization requirements, please visit the Authorization and Billing resource on Evernorth's provider website. Again, that's provider.evernorth.com. It's in the Resources section, Behavioral Resources, and Doing Business with Evernorth. You can submit a paper claim on a UB04 form. For HMO, please submit claims to P.O. Box 188022, Chattanooga, Tennessee, 37422. For PPO, P.O. Box 182223, Chattanooga, Tennessee, 37422. To help ensure prompt payment and avoid claims issues, your address listed on the provider directory and the claim form must match. An admitting diagnosis is required on the form for an ER claim, and there is space for an attending MD if it's applicable. The requirements on a UB form for claim submission include employee name, patient name, patient date of birth, the identification number to help facilitate accurate claim payment. The preferred number would be the Social Security number or the alternative medical ID. If the patient does not want to give either of those identifiers, you may use their Evernorth ID along with their date of birth. Other required items include the type of service, type of bill, date of service, charge for service, diagnosis, the facility taxpayer ID number, facility name and address. Admitting diagnosis is required for emergency room claims only, attending physician if it's applicable, and the National Provider ID or NPI is required for electronics claims. You may choose to sign up for an electronic data interchange or EDI. You can use this with our Medicare Advantage program. By using this, it means that you have no faxing, printing, or mailing. Our payer ID for Medicare Advantage is 63092 for all claims. Paper claims for Medicare Advantage can be submitted to P.O. Box 981706, El Paso, Texas 79998. You can feel free to sign up for electronic funds transfer. For Medicare Advantage, you can enroll in EFT by going to Cigna.com/Medicare/Cigna HealthSpring. You can also sign up for electronic data interchange for other Evernorth products. Again, this means no faxing, printing, or mailing. You can find our EDI vendors by going to cigna.com/EDI vendors. For Evernorth, the payer ID is 62308. If you choose electronic funds transfer, the EFT is a direct deposit, electronically deposited claim payments directly into your bank account. This eliminates the need for a paper check, delivery and handling. You have access to the funds the same day that they're delivered, which can increase your efficiency and improve cash flow. You can view separate remittance reports online for each deposit and easily reconcile payments. There are two options to enroll an EFT for Evernorth. The first is to use the CAQH website. The second is to enroll directly with Evernorth by logging on to provider.evernorth.com. You'll go to Working with Evernorth, Enroll in Electronic Funds Transfer EFT Options. Transformations is our bi-monthly newsletter delivered directly to your inbox. It features industry information, administrative updates, plan coverage, as well as helpful tips. On behalf of Evernorth, thank you for your interest in our network and listening to our new provider orientation. We hope you found the information valuable and it will help you to administer benefits to your patients with Evernorth coverage. We also encourage you to refer to your Welcome to the Network email, which covers the highlights that we discussed today, including telephone numbers, email, mailing addresses, websites, and more. Thank you again.